Thanks, Grace, for that update. Of course, coming back to you to get more information about that particular happening. All right, moving on. The government has proposed the creation of a national authority to license and regulate facilities, ensuring compliance across public, private and faith sectors. In a new bill, the Quality Healthcare and Safety Bill 2025 that was highlighted by Health CS Aidan Dwale before the National Assembly Committee on Health. The government seeks to establish uniform health service standards, protect patient rights and hold facilities accountable. Let's cross over to that meeting that is currently happening now.
As a country going forward, we must know, because of even the budget cost of the internship, we must know how many interns are we producing in the medical doctors, for example, clinicians, nurses, in the next 10 years, for even Parliament and the National Treasury and government to make a progressive budget. So I really want this committee to help me and so this bill, this amendment ourselves, we have an issue, and we want to clean that scope of service. We want to know everybody what is his role, what has he studied for, and all this comes back. We have no other interest. Our interest is those who are treating patients in our health facilities across the country. So I'll give to my colleagues from the council to also give their views, but you know, every morning we cannot register different cadres of professional groups in our health sector. We must have order, we must have some discipline, we must have some rules of the game. We can't just run the health sector in a very pedestrian way. Thank you, Chair.
Thanks again. We, the council, are in actually full agreement with the Cabinet Secretary's view. We know that this is suggested as a temporary measure, and we would like, of course, to know those among the cadres that fall within what is supervisable by a doctor or a dentist. Those can be given that period of help until the final solution is made. The Cabinet Secretary correctly said that the theatre technicians for now, who are primarily nurses, would not fit into our skill set of looking after. But overall, being a temporary measure, and we must also align a small group that can do work that is related to the two major professions, dental sciences and medicine. Beyond that, it would be confusing, I agree, to just have everybody defining themselves as a health worker and falling into the body.
Well, this bill actually sought probably the time to think of do we need all these authorities, or actually we can start to regroup them, and so that some come into the same. Because all he's suggesting here, put these ones in already existing authority. So I think that's the way we must go. Maybe to just comment a little on what you said. Of course, you are touching on the Commission for University Education. That University Act, is it Section 5? Is it 5A? It's Section 5A. I've struggled to get it amended, but now the way you are talking, you are going to work with us. I think we need to get it amended. And then the scope of work is important. We are going to have cadres that have different names, and you can't tell. You'll have a country where people with degrees doing the same thing have different names. We can't go that direction. So I think on that we agree with you. Adding more people into an existing is good, because it stops that group trying to get another institution in place. So I think with that, I'll ask Honorable Madenge to make a comment, but we've heard you. And then Because
in my approach here, I looked at teams that are doing related work, same work environment. And when you come to the surgical operating environment, the preparation of the theater, intraoperative procedures and post-operative procedures are an integral part of surgery. And therefore we have to ask ourselves whether within the protocols established for the operating environment, when you have this segment of support.
And now let's go to the ongoing voters registration.